my name is Chris Sheffield, and I'm a nursing student at James Madison University. And I'm going to talk a little bit about a situation that I experienced during my nursing career and how that relates to the Nursing Code of Ethics. So for a while, I was a forensic nurse examiner, and it's actually pretty common to come across situations in which a judgment call needs to be made about what is the right thing to do, both legally and ethically, for a variety of reasons. The situation that I'm going to talk to you about is a little bit unique in that it actually hits on a lot of the different provisions of the Nursing Code of Ethics. So the patient came in as a victim of a sexual assault, and she was brought in by law enforcement officers, and both the law enforcement officer and the physician that was seeing her both seemed very adamant that they wanted her to go through with evidence collection, or what's called a PERT kit, or a physical evidence recovery kit. But the patient wasn't sure that she wanted to do that. And according to the Nursing Code of Ethics provision 1.4, she ultimately has the right to decide what she wants to do. It's the provision of self-determination. So all patients have a right to decide what type of health care they do or do not want, and to be able to provide informed consent for what they do receive, and forensic patients are no different. In this particular case, the law enforcement officer was a bit abrasive and quite pushy, actually, in that he really wanted her to go through with the evidence collection, and she was unsure. So the Nursing Code of Ethics provision 1 also has dignity in there, and respect for the fact that she knows what is best for her at the moment, or at least she has the right to decide what she wants in the moment. And part of the Nursing Code of Ethics as well, 1.2, is relationships, and it's very important as a forensic nurse examiner to build trust with your patients. And part of that trust is them understanding that you're not going to do anything to them that they don't want, and that you fully respect that they're in control of the situation and they get to choose, regardless of what I or anyone else thinks that they should do. Also, 2.1 is primacy of interest. So that means even if the overall good of society may be to collect evidence to potentially put away someone to keep them from hurting someone else, in that moment, what is most important was my patient and what was best for her. And at the time, she was not wanting to go through with evidence, and that was okay. 2.3 also covers collaboration, and in this situation I had to collaborate with other healthcare professionals, law enforcement officers, and even radiological techs as well in this particular situation. So ultimately she decided to do the evidence collection, and afterwards she called me quite frequently, and this is another reason why I brought up her case in particular, because provision 2.4 covers professional boundaries, and that was something that I had to purposefully draw with her, because even though I was a forensic nurse and I was there for her and I took care of her, there was a point where my role, my job was done, and she was essentially using me as someone to talk to, because she had attached to me because I was kind to her and I was there and aware of the traumatic situation she had been through. But I did have to have a conversation with her and encourage her to see a therapist that specialized in sexual assault, because I was not the most appropriate person for her to be contacting, and it wasn't really appropriate for her to call me on a regular basis months later after a sexual assault. That is outside of my role and my scope of practice, so drawing professional boundaries was very important. Also, privacy and confidentiality. So even though she did agree to see me, anything that she had told me I still couldn't release to the police without her permission, and that even includes the sexual assault kit.